Parents out there, or soon to be parents. This is cool. Developmental scientists and medical social science experts at Northwestern's Feinberg School of Medicine have spearheaded the creation of a new tool. They're calling it the National Institute of Health Toolbox. And this is a tool that provides standardized assessment of cognitive, language, motor skills, and social emotional skill development for infants as young as 16 days old. So, why is this so important? This research, it can basically give an indication for are they on track to have a normal and healthy development over the course of their life. So joining us now is Northwestern University Feinberg School of Medicine's Richard Gershon. Dr. Gershon, thank you for joining the program. We appreciate it, sir.
Thank you, Anthony. Caitlin, thank you for having me.
Okay, I'm going to start it off really general. What is in this toolbox, sir?
So we worked with a team of researchers from literally around the world to create on behalf of the National Institutes of Health a series of 40 measures that can be given to children as young as 16 days of age and up to 42 months of age. And we can identify broadly based on cognitive functioning, things such as language development and executive functioning, motor functioning, where's a child at relative to the ability to get up, to walk, to move around, social emotional functioning, and so up until now, most assessments in this area were done by parent observation, which is good, but parents often feel that their children are gifted or they feel that they have lots of problems. We need an objective way of doing this, particularly for use by researchers, educators, and clinicians. We're not quite ready yet for parents to give this to their children on their own, although they're the ones who would bring their child in and work with them. This is not, we're not expecting to put the baby in a box somewhere. This is them doing natural observations and being able to assess what they're doing.
So it looks like you have an app. Is this right? An iPad app that uses video and eye tracking to measure babies' learning and responses. Is this something that you were mentioning, like that could assist the parents with their observation of their child?
Right. So we did it as an iPad app because there are lots of specialized equipment that's been created over time, but it's just too expensive to maintain. And the latest iPads have the ability, we train the iPad to follow where a child is looking on the screen. So we can put an object on the screen or several objects on the screen and say, look at the spoon. Where is the spoon? And we can see where the baby's looking on the screen even prior to their ability to talk. And then we also use it for things like taking videos of their motor behavior and guiding a person through a structured evaluation. Are those motor behaviors up to date? Are they developmentally appropriate? Is it something to watch out for, or are we just tracking?
I remember one of the most nerve-wracking parts of being in the recovery room after both of our boys were born, over at Northwestern, by the way, doctor, was when they came in and did the hearing test. Do you remember this, Caitlin?
Yeah.
And you're kind of like, you're on pins and needles during that, like, I hope everything is normal. You know what I mean? Like you want, bottom line, a lot of people are concerned about boy or girl. I was just more in the 10 fingers, 10 toes.
Okay?
Yeah, exactly, exactly. Dr. Gershon, why is this so important to get this? I mean, you're saying between 16, as early in life as 16 days. Why is it so important to get these metrics documented and observed so early?
So in many cases, all we're doing is seeing that a child's on track. And by the way, child development varies widely. As parents, you know, if you have more than one child, they develop differently. That's all okay. But also, more and more, we think we can detect early signs of autism. We can detect early signs of diseases. And if we have the opportunity to give that information to a clinician or an educator, they may be able to do interventions early on that may be able to provide aid to that child in such a way that it will make certain that those, whatever difficulties they're having early on, will not affect them later in life.
I would love to know, if there's parents out there that are listening that have newborns. As Anthony, just like you, I was worried about everything. What are the main things that you've seen in your experience at work, the main red flags with these young ones that parents should be aware of?
Not really my area. I'm a measurement scientist, and I work with people who are experts in this area, so I don't want to stretch too much.
Yeah.
But I think parents have a very good gut of what's happening, and they can see other children around them. So speaking more as a parent than as I'm certainly not a pediatrician. If a child's not developing like their peers, find out what's going on. But on the other hand, I have a daughter who's now a school principal, and she was off the developmental curve on the small side. She was, too small for the quote norms of development. But she continued to progress all along. So, I mean, we have to be careful. Most children grow up to be very productive, right? And they're on a different path. And what the NH Toolbox just allows us is to assess that, track it in research studies. We're using it right now in a study of 70,000 children to see the impact of the environment. Is air pollution or plastics really affecting child development? As parents, we worry about all these things, but there's very little, on some of those things, there's not objective evidence. This is it. We've presented a tool for clinicians to look at those things.
That's so great. So it's already in effect. It's already a tool that is being used to track tens of thousands of infants. How long is that research going to last? Like in terms of the sample time frame that you are going to be able to have access to for this information?
So right now, the Environmental Child Health Outcome Study, ECHO, is a nationwide study. It's conducted at hundreds of locations. We are responsible for the measurement, including things like the Baby Toolbox. It's in its 10th year out of funded for 14 years so far. I would hope that it will continue to be funded because an important part is tracking the children as they grow older.
Right.
Are things that we observed at 6 months predictive of something at age 5, 8, 10, 12? But so it's really in very long term. We have biomarkers on those children to see did chemicals get into their bloodstream, at birth, and did that affect their development? And we're using the toolbox to objectively assess it. By the way, we also ask parents how they see their child doing, but we combine that information with these objective measures.
And you said how many kids are involved in this?
In the ECHO study, there are so far, I believe, 70,000
That's
children.
unbelievable. And you've been tracking them since birth.
And all those children have been tracked since birth. Some of those studies started long before ECHO, but universities around the country brought their children where they had, I think the requirement is they had to have biomarkers from birth. Did they have saliva or a blood sample so that they could look at that and then track them? So they're actually already adults in this study, but they started prior to the Baby Toolbox being around. So we don't have this kind of measures of child development. There have been other types of measurement systems that are out there. They just take much longer to give and are much more expensive. So the Baby Toolbox allows these kind of measures to be used in studies inexpensively and with low burden, right? You can't take a child and give them tens of hours of tests.
Right.
And so the Baby Toolbox allows that to be short, and then we see it being used in schools to help detect would children benefit from early intervention? How do we identify that child?
Is this Baby Toolbox going to be offered to the general public? Is it going to be widespread? Is it going to cost money? What's the future for it?
So it is an app in the App Store, but it does require what's called a Class B certification. That's somebody who can interpret test results. The reason we don't release it directly to parents is you see this number is off a little bit. And as a parent, I would say, oh my goodness, what's up with my child? Just like the hearing test that you saw. But that doesn't necessarily mean very much. It's tracking it over time. So it's available currently in the iPad store. It does require, you can look at look at some of the materials there, but it does require a person being a psychologist, a neuropsychologist, a child educational psychologist, somebody. It's easy. It's relatively easy. It does require some training to give these tests, but most importantly, somebody who can look at the results and say, that's meaningful for your child. Nope, this is something to watch. Don't panic. And that's why we limit its use and are not giving it to parents directly at this time.
Richard Gershon, thank you so much. This is fascinating. I will be keeping my fingers crossed that this funding never runs out so that we can get great data for many, many years to come, sir. Thank you for everything you're doing.
Thank you very much.
Yeah, this is answering some of the questions we've always had as parents, the impact of the sun and microplastics and whatever diet they're on. You know what I mean? We need good, solid data, so they're doing really, really great stuff.